surveys are a free service available to schools implementing KidsMatter. The surveys provide an important tool to support schools in the consultation process with their school community. The surveys are permanently available and allow you to access your results when you need to. Finding out what your staff and parent community think about whole school mental health promotion and student wellbeing is a powerful way of engaging community voice in the consultation and planning process. So how do you get started? The first thing is your action team attends a Getting Started event. At that event, you'll find out about the surveys and you'll be asked to identify an administrator at your school. That person will receive the email that provides you with login access details to your school's reports and also information about how to run your surveys. So before you survey, what should you consider? Will it provide new information? Are participants adequately informed about KidsMatter? Perhaps you might need to provide some additional information. Will participants understand why they're being asked to participate? Importantly, you also need to consider who will do the survey. Staff will probably do the survey, but maybe not all of your parents. It might be that you just want to focus on a particular year level, and so it's just parents of the children at that year level that do the survey. Online or paper-based, that's another really important thing to think about. You also might want to consider who might be having difficulties doing the survey. It might be parents having language difficulties and that you might need to provide some support for them. So how you use the data is also another important thing to consider. And also you need to think about who is going to see those results. So when should we run the surveys? KidsMatter strongly encourages you to collect baseline data before you commence the implementation of KidsMatter. That gives you a view of parent and staff views of where your school currently is at. And once you've commenced training, you can redo those surveys after Component 1 training, for example, and compare those staff results with those baseline results that you originally collected. We encourage you to actually do it after Component 2 training with staff, and then after Component 3 training, we strongly encourage you to re-involve parents in surveys, so then you can compare parents' views with that baseline view captured at the beginning. Once you are into a process of a sustained implementation, we strongly encourage you to then do those surveys once a year just to monitor how your school is progressing. The next step in the process is thinking about how you actually run your surveys. The big question is, do you want to run it paper-based or online? It might be that you want to do it both ways. If you're doing paper-based, it's important to make sure that your school is well informed about why you're running the surveys. You need to let participants know when to do the surveys and how to return them to you. It's also very important to stress that the surveys are anonymous and that people shouldn't be overly positive in their response. So you've administered your surveys, you've got them back. If you were doing paper-based surveys, you need to collate them online. So you use the online methods of surveying and that collates the information for you. This gives you the ability to have access to those interactive online reports. If you've administered your surveys online, then you have automatic collated results and you can gain access to them through your online reports. For each of the parent and staff surveys, you are provided with two types of reports. One is called the overview report. The overview report provides item-by-item results. It allows you to filter the data by different time points, and it also gives you access to those open response comments where you can create word clouds. The other type of report is the school mental health map, and there's one for parents and one for staff. The mental health map brings together individual items and groups them back into the component areas and the target areas underpinning those components. It allows you to bring together different time points if you've done the surveys on several occasions and compare across the national average. So what should you consider when you're using your results? What's the difference between staff and parent surveys is one important question. Essentially, the staff surveys are designed to really closely match the component areas. The wording around the items are quite strongly aligned with the goals, and so it's a very close reflection of where your school is at. The parent survey is much more open and broadly aligns to the 4 components. Another important question is, how representative is your data? In the social sciences, a response rate of 75% is considered very good. If you've got less than that, it's important to consider who might not have participated and how representative your data might be. So just keep that in mind when you're actually considering those results. So the survey results allow you to compare across different occasions. If your data goes up, that's great, but what happens if your results go down? Quite often we do over-positively respond to items, and people have a predisposition to think that they understand something when maybe they don't have the depth of understanding. This means that they might be over-optimistic when they respond to the items the first time around, but when they've done the training and have a deeper understanding of what KidsMatter is about, that they're a bit more critical about the way they respond. A decline in results might reflect a deeper understanding that your staff have around mental health promotion, and isn't a bad thing at all. If you've got staff and parents to fill out the surveys, then there is the opportunity to actually compare staff views with parent views. Now, while there is not an item for item match, the items are developed around the components so that you get a general view of where staff think on the mental health map in different component areas, and those can be broadly compared to parent views in those same components. So how do you use your results in planning? The first thing is to look at those broad results on the mental health map and try and write summary statements. What do those results mean for your school? You should also consider the individual items and actually look at the way the responses are across those particular items. For example, there might be an item where there's a group of staff strongly agreeing about that item, but there might be a smaller group of staff that actually strongly disagree. So how might that influence the way you plan for your school? Those views should be considered equally. So once you've done those summary statements, you want to transfer them over onto your component plans, and there's a special column there allowing you to be able to write those statements next to the actual goals in the component plans. You also have the opportunity to write the summary statements for the parent survey, and those can also be transferred onto the component plan. So once you've transferred those summary statements, you want to start thinking about developing specific goals. Once you've developed those specific goals, you then want to complete the rest of the steps. In doing this process, it might highlight things that require specific and urgent attention, and we strongly encourage that you do that. So once you've completed your component plan, you might want to then think about how you feed that information back to your staff. It could be presenting it at a staff meeting or writing a document that staff can read. You should also consider feeding this information back to your parent community and to your students. So you've filled out your component plans, you've downloaded your reports, and you want to bring it together in a full document. We would recommend that you do this and call it your school mental health strategic plan. So once you've created your strategic plan, then it's really a time to celebrate.